Lifeability family, I'd like to introduce you to our guest speaker today, Laura Bratt. Laura is a licensed master's level psychologist and a board certified neurofeedback therapist. Laura began working in the field of mental health in 1982 prior to her graduate work at a women's clinic in Dallas. After receiving her master's degree in counseling, she moved to Florida, and during that period of time, she worked in a variety of settings, including locked and open psychiatric units, chemical dependency hospital units, and outpatient social services. Laura's introduction to neuroscience-oriented work began with a shift to working with brain rehabilitation at an inpatient rehab facility. The neurofeedback chapter of Laura's life began in 2003 when she and her husband began their own emerging neurofeedback practice. Laura's interests are varied, working with the monks of Plum Village in France, trauma concussion healing, neuromeditation, programs for veterans and first responders, recognizing working with highly sensitive individuals, to name a few. While being a community neurofeedback center that addresses the needs of the community, the focus is always on utilizing all the techniques and technologies to optimize each individual's brain in the pursuit of self-empowered health. It's Laura's guiding principle that each individual is functioning optimally when the brain, heart, and the gut are all aligned with the body, mind, and spirit, and this is then addressed as part of the whole. I hope you enjoy today's episode. Welcome, Laura, to the Lifeability podcast. Thank you so much for being here and supporting my mission of reaching the wider audience to allow them to explore and embody various strategies so that they can create a more fulfilling life for themselves. So I would love for us to start off with you sharing a little bit about your journey and what's driven you into neurofeedback therapy in particular.
Okay. Wow. I'm not even sure where to start that. So I guess where I'll start is I had a whole lifetime, I think, before I even got to the neurofeedback phase of my journey. And that lifetime we might touch on at some point later on or not. But it was probably 2001, and my husband had a private practice, and I was actually not working at the time. I was home with kids, and he went and did a training for neurofeedback and came back and said, "You need to learn this." And I said, "No, honey, that's weird. You can do that. I'm not interested." And for about a month, he bugged me and said, you really need to do this because we need to do this together. And after about a month, I relented. So that's what started me and got me into the class. But what kept me there was my own initial experience with neurofeedback, and then starting to do it with family first, and then some friends, and then starting working with clients. And that was 2004, maybe. Maybe I had my dates off, yeah. Maybe it was 2003 when he approached me, 2004. And since then, I've only added to the neurofeedback work I do, but that's always the basis of everything.
And so for our listeners that don't understand what neurofeedback is, could you give us a little explanation on that?
So neurofeedback, quite simply, is biofeedback for the brain. It uses EEG technology, sensors, and basically what we're doing is training brainwave patterns. We are attaching sensors and then hooking them into an amplifier, and then literally the client is in front of a video game of sorts or a movie, and the clinician is in front of a screen showing brainwave patterns. And basically, the client's job is to keep the game going, keep the game beeping, or keep the movie going. The clinician's job is consistently following whatever the client is doing in order to open up and close parameters to keep the game going. So it's probably easier with a video, but the goal of neurofeedback is to enhance regulation in the brain. And the way that we do that is setting up certain parameters so that when you're doing a really good job, for instance, when you're doing a really good job and you're keeping the game going, my job is to make sure you're getting an appropriate number of rewards, which are in the form of beeps and visuals with the game or the movie continuing. And as you do a better job and you're getting more beeps and more reward, I make it harder. If you're struggling, I'm going to make it easier. So I'm constantly kind of responding to how you're doing. So I want to say that in our discussion, I'm discussing neurofeedback specifically in the approach that we use in my clinic. There are various other approaches, most of which are really good and really helpful. But the one that I use is the one that works spectacularly well for us. So.
And is that is there a name for the one that you use?
The software that we use is Eager, which is, it's not super user-friendly. It's pretty difficult to learn, but it's incredibly good for targeting specific areas, specific issues, specific networks.
Okay.
Go ahead.
That was going to be my next question. We know that the brain controls different areas of our bodily functions, and so when we're looking at neurofeedback, are there specific areas of the brain that we're targeting, or is it pretty much whatever the client's being challenged with, whether it's an emotional thing or a motor planning issue that then can be resolved?
So, really good question. The brain is richly connected. And so when we talk, and I do speak in terms of targeting this area or targeting this location, but it's not really fair or appropriate because the brain is so richly interconnected. You can't target here to get that particular thing or that particular behavior, or target here and do that. But what happens when you increase neuroregulation in one area of the brain, it's kind of like throwing a little rock in the pond that ripples out, and that enhanced regulation will ripple out. So frequently, I'll start with a client just to begin some stability training, just to enhance stabilization and regulation, just overall as a start point. And then I might move to the back of the head. And once I get to the back of the head, after the stabilization training, they already look better than they did on the initial evaluation, because some of that regulation has already rippled out to the back of the head, and I haven't even gotten there yet. So it's not necessary to train spot A in order to get this desired response.
Right.
Kind of thing.
So if someone's had a stroke, for example, and their Broca's area has been affected,
Okay.
we can't target that to, get their speech improved.
So we can, because part of that area might have healed, part of it might be completely dead, right? Based on wherever the particular stroke was. So what I don't know is what connections have developed post-stroke. And so if I know somebody's had a stroke in Broca's area, so I might start with a training that's nowhere near that. Maybe I'd
Right.
start at CZ or something right here, because the first thing I want to do is just kind of stabilize that nervous system. So I might do several trainings of just stabilization and regulation. And then obviously, we might want to train around Broca's area. And if I did a couple trainings and we got nothing, then I would shift slightly.
Mhm.
Or I might target other areas that we know there's connectivity between Broca's and these other areas.
Yeah.
There's a lot of ways to get to where we want to go.
Okay. I'm just trying to understand your theory around stabilization and the purpose of that before targeting. Is that more to do with, the fight, flight, freeze response and allowing the body not to panic and realize that it's in a safe space before you actually start doing some targeting? I'm thinking of, things like PTSD.
So I think my I think probably the attraction to stabilizing first is more just how I approach neurofeedback training. Um, I don't. That's not how every practitioner does it. Um, I have just found that when I start with a few trainings just to stabilize and regulate the brain, um, it introduces the idea, because I'm going generally into a nervous system that's pretty unstable. So I would never start with frontal training. The frontal lobes can be pretty volatile. And so ideally, I want the nervous system to understand we're going to come in and we're going to do some stuff. And I guess the way you stated it, maybe you're right. Maybe that is what I'm trying to do, is just let the nervous system know, here, we're here. This is what we're going to do. It's cool. Everything's fine. The areas of the brain when you're talking about trauma or PTSD, either developmental trauma or PTSD, CPTSD, um, I always start with stabilization and regulation, because frequently just starting that training um, allows the individual to feel just a little bit steadier, just a little bit more solid, and it might even help their sleep. And just doing those two things, I've already made an impact. And that's just within a few sessions. So I suppose you're right. I'd have to really sit with that before I completely agreed with it, but maybe that is what I'm doing.
Yeah, yeah. And so for something like cerebral palsy, knowing that that's lack of oxygen in the brain during birth, would neurofeedback help someone at a really young age? Or are there, uh, I guess, precautions as to when you can start using something like neurofeedback with somebody?
So the only caveat to using neurofeedback for me is that they're medically stable. That would be it. The youngest child I've ever worked with is 4. I have colleagues that have worked on their infants,
Right.
so
Yeah.
I haven't tried that. So age is not an issue, as long as the child. Sometimes the child might be seated on a parent's lap or something, just so they're not wiggling out of the chair.
Yeah.
That's more the issue. Um, but age really isn't an issue. So for CP, so I've seen um, a number of clients in our clinic. They're not coming in specifically for CP, they're coming in for other things. That's more of a secondary. It's more attention, it's more sleep, it might be pain. It might be enhanced speech. It might be anxiety, depression. It's not specifically the CP.
Yeah. And so,
That's
in your experience, have you found neurofeedback to work particularly better for a certain cohort compared to others?
I'm sorry, a certain what?
Cohort, so certain target medical conditions.
So, so we've utilized neurofeedback for a lot of mental health issues, psychiatric conditions, and a number of medical conditions, many of which I never heard of until the person walked in.
Right.
Um, so I um, had my first triple PD client just within the last year, and I've been doing this a long time. So I had to Google what that was.
PD, did you say? Yeah.
Triple PD. Are
What
you?
is that? I'm not
That
aware of.
is. I'd have to Google it to get all the P's, but persistent postural something disorder, and it's just a highly specific disorder where the individual's vestibular system is offset by a shift in gaze, really subtly causes a tremendous amount of anxiety, and it's very destabilizing. And actually, Dr. Jeffrey Staub is the physician that coined the name triple PD.
Right.
And I had a conversation with him because this woman walked in and was coming in specifically for me to work with that, and I didn't even know what it was. So I called him and said, "Hey, their typical form of treatment was, whoops, losing the connection.
Um,
I think
Am
we're
I back
good.
on now? Yeah.
Yeah. The typical treatment for triple PD is CBT, cognitive behavioral therapy, and SSRIs, and psychoeducational piece. I told her I'm not doing CBT, and she said, "I know. I'm coming in for neurofeedback." And so I talked to him, and he said, "Well, I've never really heard of that used. I found one paper that did indicate neurofeedback was helpful with triple PD, and we worked together, and she did spectacularly well.
Yeah. Wow. Okay.
In
And so,
fact, came off the SSRI."
yeah, that was going to be my next question. What sort of role do medications play with the whole process of neurofeedback? Because you are working with the brain predominantly, and so if someone's on medication and has been on something for a long time, how does that impact what neurofeedback's actually doing, and whether there is contraindications to that?
Haven't found any yet. There's most people that walk in my door are medicated. That is just kind of the state of the world now, at least in the United States. Um, and so, generally, what I ask is if you just keep your medication stable and don't make any changes, just take them as you have been. That way, we know that the changes that you're seeing are due to the neurofeedback.
Right.
Now, if somebody's titrating their meds up or down, I tell them to wait. Excuse me, because um, I don't know what the changes are due to. It's hard to parse out what's the neurofeedback and what's a med effect. And that's really important because when I work with somebody, I don't have a prescribed protocol where I'm going to do this and then I'm going to do this and then I'm going to do that. I'm starting with stabilizing, right? Regulating. And then we're checking in to see where their symptoms are, what their goals are. And then I determine the protocols based on where they are and where they want to be. And if the meds are interfering in that process, it's not productive.
Yeah. But you've had people that have had neurofeedback therapy, had many improvements, and then have gone off medication.
Yes, that's dependent on if the individual, or we see a lot of kids in our clinic too. If some parents want the kids to stay on meds, some people want to stay on their meds. So if they want to stay on their meds, we stop the neurofeedback early, because when you when you complete so many neurofeedback trainings, your nervous system is better regulated. And because it's better regulated, your physiology is tolerating the meds differently. And so when I'm working with college students, I'm always having this discussion that, remember, if it took you 3 beers before to feel pretty tipsy, it's going to take about 1.5 now. So be mindful of that, right? And so the same thing with drugs, any kind of drugs, is the body is processing that. And so it's going to take less to get to the same place because of the neurofeedback training. And so if you're wanting to stay on your meds, we're going to cut the neurofeedback training sooner than we are if you don't want to stay on your meds. And then because we want to continue to make sure the body's doing what we need it to be doing, what you're wanting it to, what you're wanting done, what you're looking for without the meds.
And why would someone choose to stay on the meds?
Fear.
Right.
You know, there's a lot of folks that I've seen over the years, particularly people that are on benzos, that are really afraid of not having them. Yeah. So there are a few that come in specifically to get off the benzos, because that's a tough process.
Yeah. Very interesting that someone would seek something like neurofeedback that is actually targeting rewiring the brain essentially, but still choose to then stay on medication in the long term. So with neurofeedback, are there certain number of sessions that you recommend someone to have, depending on obviously what's going on? And then do they need to have like a maintenance program, or is it something that kind of fixes whatever issue is going on for the long run?
So, so money, and because in my clinic it's all private pay, so people are all paying out of pocket for these services. So, so I always ask people to not get started unless they're prepared to do a bare minimum of 15 sessions.
Okay.
Because generally, I hope and expect some solid positive change, not done, but solid positive change somewhere within the first 10. And then we get another 5 in, and then I feel like at least those changes should be set. I feel pretty good about it sticking. That's not what I would want. I'd say, I mean, when you look at the literature, particularly some of the historical literature, because the neurofeedback literature goes back to the late 60s, early 70s. Initially, it was used with ADHD and epilepsy. Generally, they're talking 40 sessions of neurofeedback. Okay. There's probably not the majority of people that we see that do 40 sessions, would be great. But generally 20 to 30, I think, is a really good amount. Generally, people can meet their goals, which we set at the very beginning, somewhere between 15 to 25, 30. There are people that I've trained for over 100. So to your question, as far as a maintenance program, it used to be when people came in and I was discharging them and we were closing out, I would say, should be good to go. The 3 cases in which you may need to come back and do some booster sessions would be the case of a physiological shift, a hit to a head, car accident, a major psychological shift, a bad breakup, a house fire, or a huge hormonal shift, puberty, menopause, things like that. And in those cases, frequently people, and I frequently have people showing back up, right, years later for booster sessions. But what I think it's probably safe to say is since COVID and since that period of time, the environment that we're all swimming around in is much faster. And there's, I would say, increased toxicity. And so I'm not sure that I can say with the same level of assurance that I said pre-COVID that you're kind of good to go. Because I think the level of resilience that's required now is much higher than what was required pre-COVID.
Interesting. When we talk about the brain, how there's the conscious brain and the subconscious brain, and whether any of that has got to do with some of the subconscious beliefs that we hold, and whether, I guess, neurofeedback can help rewire some of that. Firstly, we've got environmental toxins that affects the brain as it is anyway. If neurofeedback is a treatment modality that we can use, or that anybody can access and use, would it benefit everybody really? Second question then being the conscious and subconscious brain and rewiring some of our subconscious beliefs, whether neurofeedback would be useful for everybody also. Because we've talked about people with certain health conditions or certain issues, but I look at the body as, if we're having physical symptoms, there is physical symptoms are really manifested because of emotional repression or not necessarily having going through whatever's happening in our subconscious brain. And so if we were to use neurofeedback, would that help everybody?
Yes. And that's a whole sentence. Yes. And I'm glad you asked about that, because if neurofeedback was done in elementary school, and then maybe repeated in high school, right? We wouldn't be living in what we're living in now, because there would be way more humans walking around the planet in a better regulated state. And I'm not comfortable separating out the conscious versus the subconscious, because I can't, I don't know, I can't like separate them out. It's all together in this one human, you or me.
I guess
And
when I talk about the conscious and subconscious, is more just about like our preconditioning and how we pick up a lot not necessarily being aware of it. And so I wonder whether, if everyone had access to something like neurofeedback, whether that would resolve some of that. And then we would create a world, like you said, that is not fear driven, and not as chaotic.
Could you please do that?
That would be awesome, wouldn't it?
All right. Yeah. Yeah. Um, yeah.
Mm.
So um, there are a number of there's a lot of people that use neurofeedback, specifically artists and athletes that use it to enhance their skill set, right? There was a spectacular study done at the Royal Conservatory of Music in London. And Griselier was the author of that study. That's about all I can tell you there. But it was amazing because the judges that determined the qualitative changes of the capability of musicians, that's what changed with the neurofeedback, was the quality of their playing. So the point of the neurofeedback is to enhance me to be functioning at my highest, my optimal level of capability. Whatever I am gifted with, whatever I have worked at, all of that ideally coming together so that I'm at the top of my game. So whether I'm coming in and I have anxiety or I have a sleep issue, or I'm a decent pianist but want to be a really good one, but say I'm really gifted, ideally, neurofeedback helps me deal with all of that. So I become a much better pianist at the top of whatever, not just the skill, but the gifts. I can utilize all my gifts because I've optimized what I have.
Mm.
Does that make sense?
Yeah, it definitely does. And I want to finish off with talking about the role of lifestyle and the impact on um, neurofeedback, because I would think, if someone is accessing neurofeedback and the purpose of it is to stabilize, if they're going back to a lifestyle that's unhealthy, is that then going to um, disable that process, or shorten the time that someone's had benefits with their brain waves?
Um, so it certainly doesn't help the process. It can hurt the process. There's actually, um, are you familiar with PANDAS? Um, it's pediatric autoimmune um, neuropsychiatric syndrome.
Okay.
Very long title. Um, and when the first kid I met with PANDAS, I'd never heard of it before either. But that is, it's a really kind of oddball disorder in kids in particular that have a history of a lot of strep infections, and they become highly anxious individuals. And it wasn't until more recently when they discovered this disorder that they realized the anxiety was stemming from this, basically a gut issue.
Mm.
And it's from a lot of strep infections. It kind of really upsets the balance of the flora and fauna of the gut. And I now frequently, I can tell during the initial eval if this might be a PANDAS kid, because they tend to come in with some pretty heavy duty OCD, a lot of anxiety, big history of strep infections. And a lot of their fears are very odd. They're just strange fears. Those are typically the pandas kids. And I've learned to send them out first to get their gut online, because I can do a lot of neurofeedback and it won't stick.
Yeah. Yeah.
But once they get their gut online and come back in, they do spectacular.
Yeah. Which makes
So
complete sense to me.
yeah.
If we're throwing them back into the environment that's actually creating all the issues, then no amount of neurofeedback's going to help. But if we do change that,
Hmm.
then yeah, 100% agree with you.
Yeah.
Awesome. Thank you so much. I want to finish off with three questions that I love asking my guest speakers. Um, the first one being, what are three resources that you can recommend for someone who's wanting to understand a little bit more about neurofeedback?
Okay, great question. So I actually wrote down a few websites. These are dry websites. These are if you're looking for providers or if you're looking for research. Um, BCIA.org is the certifying body for neurofeedback professionals. So it's kind of a dry website, but it gives you who's certified. At least those of us have had to pass a test, because there's a lot of things masquerading as neurofeedback now, um, and it's not going to yield the same results.
Is
So
that American based or is it global?
that's global. BCIA is biofeedback. It's an international association.
Yeah.
BCIA.org. Also, ISNR.org, I believe, is also international. And I did want to mention ANFI, which is Australian Neurofeedback Institute, is anfi.org.au. And I have a very dear friend that works in ANFI who I just saw in March for the Trauma Summit. So they have a very thriving neurofeedback part of right there in Australia. So there is a book by the woman, her name is Seaburn Fisher, and it's called Calming the Fear-Driven Brain. She's a colleague of mine. She's written a spectacular book. She is actually the person solely responsible for bringing Bessel van der Kolk, who I think a lot of people will be familiar with. Bessel was brought into the neurofeedback world by Seaburn Fisher.
Okay. I didn't know
So,
that.
yeah. So I highly recommend her book, of course, his book. Um, it's an old book, but it's a really good read for just kind of beginning and finding out, is called Symphony in the Brain. Um, it's talking about kind of the humble beginnings of neurofeedback.
Amazing. Thank you.
Oh, yeah. Okay. I'm trying to stay on your time schedule because I could probably talk to you for 6 hours straight.
That's okay. I'm pretty passionate myself, so I have to cut myself short sometimes. Um, Second question being, how would you like to see the future of holistic health and well-being?
Wow. Well, that would probably require a 6 hour response. Um,
Got 2 minutes.
Health and wellness needs to be a team approach. That's the basic thing. Neurofeedback is going to help most people. Heart rate variability training is going to help most people. DBR, which is deep brain reorienting, is going to help a lot. It's going to help the trauma folks, of which most of us are. Um, Eating healthily is going to help all of us. The move towards wellness, there's no singular ingredient that's going to make things great or perfect. There's a number of different things, and what's going to help you might not be all the same things that help me, but maybe we have two that are in common. It's got to be a team approach. I have a lot of my personal and professional history in the addiction world. And if neurofeedback was added in for addiction health, we'd have a much healthier world. Because the things that cannot be addressed by just pulling out the drug or the behavior and helped with a program of sorts, whether it's a 12-step or otherwise program, is you've got to regulate that human body. And without regulating that human body, it's just sheer white knuckling it. So, yeah.
Yeah, and I love how you say that it's got to be a team approach, and the fact that not one size fits all. Awareness is the key, and being willing to try. So I love that. Last question being, what is your favorite occupation? And occupation meaning any activity that you do.
My favorite occupation is my work.
Yeah.
I mean, I love to travel. I love jumping on my rebounder. Is that what you're asking me?
Yeah. Whatever you're really passionate about.
Oh, I'm really passionate about
in terms of an activity, in terms of doing. I guess you've answered that. Like, you are very passionate about your work and travel. So, yeah.
Eating.
And
I'm
eating.
very passionate about eating good food. Really good food.
A big foodie. That's awesome.
Yeah.
Thank you so much. If people want to find out a little bit more about you and your work, where is the best place to find you?
www.midwestneurofeedback.com. So
awesome.
Yeah.
Thank you.
It was wonderful.
Well, this is where your journey of exploration continues. Please subscribe to the Lifeability podcast so that you can stay tuned when new episodes come online. You can also follow us on Facebook and Instagram. The mission at Lifeability is to inspire you to create a more fulfilling life for yourself and improve your quality of life. So why not share this podcast with your loved ones and create a ripple effect together? Until next time, Asante Sana.